Let's get to work. Healthcare and well-being company, okay, with a mission to help people live healthier lives and make the healthcare system work better for everyone. We have two businesses, Optum and United Healthcare. Okay, Optum. Yeah, you got a shard across VRAM. I've used I've used the 2 terabyte RAM machines. Um, I feel like GPUs got the parallelism that you need here. So, but one of my colleagues thinks you could do it without GPUs, but I don't know. H200 pretty good, but need that high bandwidth memory. That's the good stuff. Okay, so we got Optum and United Health working to build working to help build a modern, high-performing health system through improved access, affordability, outcomes, and experiences for individuals and organizations we are privileged to serve. The ability to analyze complex data and apply deep health expertise and insights allows us to serve patients with more innovative products and complete end-to-end offerings for many of the biggest challenges. Optum seeks to create a higher performing, value-oriented, and more connected approach to healthcare. Okay, bringing together clinical expertise, technology, and data to make healthcare simpler, more effective, more affordable. We seek to advance whole person health, creating seamless consumer experience and supporting doctors with insights to deliver personalized, evidence-based care. Optum serves the broad healthcare market, patients, consumers, payers, providers, employers, governments, etc., through Optum Health, Optum Insight, and Optum RX. So Optum RX is PPM. Basically useless. These businesses, and I think Optum Insight is like data. I don't know what Optum Health does. We'll find out. That's the whole point of this. Optimizing healthcare quality and delivery, reducing costs, improving patient consumer provider experience, leveraging capabilities, data analytics, pharmacy care services, healthcare operations, population health, and health financial services. UNH, full range of health benefits. This is the managed care business. Designed to simplify the healthcare experience, make it affordable for consumers to access care. Employer and individual serves consumers and employers. This is the typical managed care we're all used to. Medicare and retirement. Community and state. Okay, so some of those are Medicaid patients, I'm thinking. Okay, Optum Health, Optum Insight, Optum RX, and UNH are their 4 reportable segments. Okay. Optum is an information technologies, like healthcare IT, enabled health services business serving the broad health marketplace. So we're going to get into this in more detail. Those who need care, patients who need the right care, information, resources, products, and engagement to improve their health, achieve their health goals, and receive the improved patient experience that's personalized, comprehensive, and delivered in all care settings. Okay. Those who provide care, physicians, hospitals, pharmacies, and others, seeking to improve the health system and reduce the administrative burden, allowing for providers to focus time on patients, leading to the best possible patient care and experiences while achieving better health outcomes at lower costs, improved health outcomes. Okay. It's pretty corporate speaky. It's kind of euphemisms. Okay, Optum Health. delivers patient-centered care, whatever that means. Oh, this is their, okay, Optum Health, this is their doctor group, right? They have like a big doctor group system. Yeah, primary, specialty, and surgical care. 100 million consumers, 100 healthcare payer partners. Primary, specialty, and surgical care. They own the doctors. They own them. Why do they own the doctors? That's not fair. We can end it. It's done. Can't have it. Can't have it. Okay, they have Optum. Optum Financial. The fuck? Optum is such an ominous word. It sounds like a fucking robot. Optum. Optum Bank. Yo. Y'all got a bank? Optum Financial? Okay. Optum Insight's probably like the really valuable software business, high margin kind of thing. Yeah, not too much detail here. But we'll figure it out. We have our ways. We have our ways, Mr. Bond. Okay. And Optum RX. So I'm just reading the company filings. So if you want to follow along, just hit the back tick button, type in UNH equity, which is the F8 key, or you can type EQ if you want. Type CF and hit enter, and just scroll down to the 10K and hit enter, and there you go. There you have it. You have the same document I'm looking at. So much faster 10K, 10Q lookup than SEC.gov. And if you're looking at SEC filings all day like me, every second counts. Your HSAs through Optum? That's so weird. Thanks, Nether. Good to be back. Okay, so UNH, for at least for employers, 29.7 million people, which we're going to be looking at these numbers really carefully in a minute. Here they tell them about regulation, some other risk factors. 400,000 employees, Jesus Christ. This is too big to fail. I skipped the risk factors because I take enough risk, man. I don't need more. Ignore that. Okay. So little opaque here. Premiums, products, services. Really odd kind of thing, but we might get some more insight here in a second. Okay. So here's Optum Health, Optum Insight, Optum RX. Okay, we actually didn't have some of these, right? And this is pretty important. Okay, here's some of the Optum. Okay, let's get these down. So basically, I'm going to try to value this as a sum of parts. So like What is Optum's okay, Optum Health, this is the physician services. So yeah, what is each part of UNH worth separately? Because they're probably going to be broken apart at the end of the day. every roll-up gets broken apart at some point. So Optum RX is basically useless. It's going to have the most revenue, but it's just buying drugs at scale and paying less for them. So there's eliminations here. The eliminations actually aren't much. So total Optum. How would country dumb go about looking at UNH? That's what I think. Forget Tiger or anyone like that. We don't need them. Well, then there's UNH. Okay, so there's UNH proper, which is managed care. So this is kind of interesting how they built this up. So there's two ways to build revenue here, which is lovely. You gotta love it. And the eliminations are kind of a little wild because, you know, they're basically saying this revenue can go in both places, which is really cringe and hard for make an accountant go crazy. Well, some of it could be we're booking the revenue that we're also insuring. Right? So you go to one of our doctors, you're going to pay him, or no, wait. Yeah. Let's say you go to one of our doctors that Aetna insures, we get paid. But if you go to one of our doctors and you have our insurance, we still get paid twice. Oh, Newegg's dropping? Nice, let's go. Let's fucking go. I knew I shouldn't have covered it. So there's two ways to get revenue. You can add premiums, product, services, and investment, or you can take Optum, UNH, and the eliminations. Both are going to be important to look at. We're still on PGen, yeah. So who's going to fill the gap on Newegg? I want to see the real good trader in me. Like the last 10 minutes, I've been like, I got to go back into Newegg. And like, it's one of the hardest things to be like, no, I covered early. I'm getting back in, but I just can't do it. It's psychologically too hard. I know it's going to keep dropping. So you got to have that. You got to cultivate this like viciousness. Instead, I'm just like, oh, I should be covering it. You know, book my profit. I mean, to be frank, I don't give a shit about Newegg. So at the end of the day, like, do I really want to be in the stock for the rest of my life? I made my trade. I made $40 almost, you know, a share. What do I need Newegg in my system for? Okay. Goodbye, Newegg. Nice knowing you. You get back to 100, wake me up. For now, I'm good. I'm good on Newegg. Huma I can short. Huma I like. Huma's a worthless company. Making a little device. What else can I short? Short a lot of stuff. Got a little eye on Q. A little capper. The capper? Should we short the? We gotta short the capper. Okay. So they are giving margins here for these businesses. And that's really important because if we split the, if we all right, so anyway, this is the country DOM analysis. Some of the parts breakup analysis. So I'm doing Optum Insight first because I think I could understand this business a little bit. Although margins dropped, so I don't know what the hell this is. But this seems like it's a software business. So they had higher margins previously. They must have gotten into some weird low margin business. But let's Optum Insight operating margin, operating profit. Yeah, they need to break this thing up, man. They need Elliot. They need an activist. Jump in there. Hey, listen, it's a nice company you guys built. It would be a shame if you broke it the fuck up. So Optum Insight profit is a little sketchy here because 3.5 billion, 4 billion, then dropped like a rock. And the revenue itself went up, but margins dropped. It's weird. So I was hoping Optum Insight would be worth a boatload. What's the stock at right now? 300. So 274 billion cap. So I don't know what you put on this, but it's not worth that much. So maybe it's worth 30 to 60 billion. Okay, so that's this part. Some of the parts. Just gonna do a little back of the envelope. All right, guys, not gonna hurt. It's a little unsophisticated, but we'll see. All right, Optum Health. Let's do Optum RX. That's 4.4% margin. Not worth a lot. And that's been the same every year, which is kind of funny. It's very consistent. And so I guess they're eating Express Scripts lunch or something. Now, I'm not going to pay a big multiple for that. I'm going to pay anywhere from 7 to 10 times. Yeah, that's still a lot. 40 to 60 billion. Some people say sum of the parts, SOTP. So this is low. This is backwards. And this is high. Okay, and now we do Optum Health. It's, just a quick little sum of parts. Now, there are some eliminations, so like technically, I think this. I just don't want to be double counting revenue because if the eliminations, I might have to adjust for eliminations. Let's see where this takes us. Then we can philosophize. My Velociraptors. Okay, 856974. 856974. All right, I'm going to pay not much for these either. Like, I'd even say 5 to 10x. It's 5 to 10x EBITDA, so 40 to 80. Okay, so argument's sake, when it was trading in the low 200s, you were arguably getting the insurer for free. And you're just Optum alone is worth $155 billion, which is not quite free. But let's look at the big boy, which is, of course, the managed care system, UNH. So margins again here very low, 5.8, 5.8, 5.2, but ton of revenue. I think what a lot of people got confused about this company, quite frankly, is it a growth company or is it not? And it's really not a growth company. And I think that the multiple got a little out of hand. Because again, my personal valuation for a managed care company is like 5 times earnings, maybe 10 times earnings. So yeah, man, fairly valued. There you have it. I mean, how efficient is the market, man? I type in 300. Look at this. Look at this chat. How fucking crazy is this? How crazy is this? That's a thing of beauty right there. Peep that for a minute. Behold that. Why is that a thing of beauty? Yeah, 5 to 10 times with no growth. How crazy is that? These are the two. This is what my point is. Wild, huh? Everything is fucking priced in. Nothing ever happens. Billions must die. Simple as that. Yeah, we're short Joby over here. That's without eliminations. So let's look at their reported operating income, right? So let's add these up. And compare that to reported operating income, which is a little higher actually. So that's a sort of a good sign. It seems like our eliminations process won't be needed. If anything, we're sort of undervaluing their operating income. Yeah, even with the breakup, I mean, how do you get the value out of this? Managed care is, I think the big change here is just managed care is going to become less and less useful. It's not that valuable. I'm not giving 20 times to a fucking managed care company. You're trying to dress up as a tech company. It ain't going down like that. My verdict in UAH, I don't need 2 hours. I did 1 hour. Is basically stay away. Let me see if I got my research component back working. So I just go to RES, pull this up. Let's see. There we go. We got JP Morgan's latest on UNH. Let's see what they said. 2Q25 miss, Focus remains on commentary on call with detailed guidance, reintroduced lower than expected. EPS came in lower than expected, much worse. Wow, $4 worse than 460. Although we believe much of the focus will be on the reintroduced guidance for at least 16 bucks a share. That's still 20 times EPS. Fuck that. Which was also well below 18 to 20 times, or 18 to 20 times, 18 to 20. Yep, model's always on GitHub. I gotta go to Morgan Markets. Oops, that was an accident. UNH reports formal compliance with DOJ regarding Medicare Advantage. Company proactively reached out to the DOJ. Special Master's report. That sounds scary. I never want to have a special master on my ass.